Your body is constantly sending you signals. It's like a built-in alarm system. But here's the question. Are you paying attention? Subtle warning signs often show up long before serious health problems take hold. Ignoring these red flags can mean missed opportunities to take action and prevent complications. In today's video, we're breaking down the most common health warning signs, what they could mean, and how catching them early could make all the difference in your well-being. Let's dive in. Persistent fatigue, a signal you can't afford to ignore. Fatigue is something we all experience from time to time, maybe after a late-night Netflix binge or a hectic day at work. But what if that exhaustion lingers, refusing to budge even after a full night's sleep? Persistent fatigue is more than just feeling tired. It's your body waving a red flag, urging you to pay attention to what's happening beneath the surface. Why persistent fatigue deserves your attention. Unlike the occasional weariness that resolves with rest, persistent fatigue often signals an underlying health issue that requires attention. For instance, anemia, a condition where your body lacks enough healthy red blood cells to carry oxygen efficiently, can leave you feeling constantly drained. Similarly, thyroid disorders, whether an overactive thyroid, hyperthyroidism, or an underactive one, hypothyroidism, can wreak havoc on your energy levels as your body struggles to maintain its metabolic balance. Even more complex conditions like chronic fatigue syndrome, CFS, can manifest as relentless exhaustion, often accompanied by symptoms like muscle pain or brain fog. Real-life example, Jane's story. Take Jane, a 35-year-old mother of two. She loved running around with her kids, managing her job, and staying active in her community. But over a few months, she noticed a shift. No matter how early she went to bed, she woke up feeling like she hadn't slept. Even her favorite cup of morning coffee couldn't shake the fog. Initially, she brushed it off as stress from juggling responsibilities, but when her exhaustion began to interfere with her daily life, making her irritable and forgetful, she decided to see her doctor. A simple blood test revealed she had iron deficiency anemia. With treatment, including dietary changes and iron supplements, her energy levels rebounded and she felt like herself again. Had she ignored the signs, her condition might have worsened, impacting her quality of life even further. How to take action. If you find yourself dragging through the day without a clear reason, don't dismiss it as just part of getting older or a side effect of a busy lifestyle. Start by observing your patterns. Are you sleeping enough but still feeling tired? Do you experience other symptoms like dizziness, weight changes, or mood swings? Is your fatigue affecting your ability to work, exercise, or spend time with loved ones? Then take the next step. Talk to your doctor. Fatigue might seem like a small issue, but addressing it early can lead to life-changing discoveries and treatments. A gentle reminder. Your energy isn't just about staying awake, it's about living fully. When you're constantly exhausted, you're not just tired, you're missing out on moments that matter. Persistent fatigue isn't something to ignore. It's your body's way of asking for help, and the sooner you listen, the sooner you can reclaim your vitality. Tash, unexplained weight loss, when a dream becomes a warning. Losing weight without effort might seem like a blessing in disguise, especially in a culture where slimming down is often celebrated. But when pounds melt away without a change in diet or exercise, it's time to pause and ask, why? Unexplained weight loss isn't just a mystery, it's a potential warning sign that something deeper could be affecting your health. What's behind unexplained weight loss? Your body thrives on balance. When weight drops unexpectedly, it's often a signal that something is disrupting that equilibrium. Common culprits include 1. Hyperthyroidism. An overactive thyroid pumps out hormones at an accelerated rate, speeding up your metabolism and burning through calories at an alarming pace. 2. Diabetes. In its early stages, particularly type 1 diabetes, the body struggles to absorb glucose for energy. As a result, it breaks down fat and muscle, leading to rapid weight loss. 3. Cancer. Certain cancers, such as those affecting the digestive system or pancreas, can cause weight loss as the body uses more energy to fight the disease or struggles with nutrient absorption. 4. Gastrointestinal disorders. Conditions like celiac disease or Crohn's disease can hinder your ability to absorb essential nutrients, causing unintended weight drops. Real-life example. Mark's wake-up call. Mark, a 42-year-old accountant, had always been on the heavier side. When he noticed his jeans fitting looser and the scale showing a 20-pound drop over 2 months, he initially felt thrilled. But he wasn't trying to lose weight. He ate the same diet, worked the same hours, and led a mostly sedentary lifestyle. His wife insisted he visit his doctor. Blood tests and follow-ups revealed that Mark had type 2 diabetes. The unexplained weight loss was a result of his body failing to process glucose properly. With medication, dietary adjustments, and regular exercise, Mark regained control over his health. If he had ignored the changes, the unchecked diabetes could have led to severe complications, including nerve damage and vision loss. How to recognize the red flags. Unexplained weight loss typically means shedding 5% or more of your body weight within 6 to 12 months without trying. Pay attention to accompanying symptoms. Are you experiencing fatigue, increased thirst, or changes in appetite? Patterns over time. Is the weight loss steady or did it happen suddenly? Context. Have you recently faced illness, stress, or significant lifestyle changes? What should you do? If you're losing weight without a clear reason, don't dismiss it as good luck. Your first step should be consulting a healthcare professional. They can help identify the root cause, whether it's a hormonal imbalance, digestive issue, or something more serious. Diagnostic tests like blood work, imaging, or biopsies may be necessary to get to the bottom of it. Why early detection matters. Catching the underlying issue early can mean the difference between managing a condition effectively and facing more severe health consequences. For instance, hyperthyroidism is treatable with medication, diabetes can often be controlled with lifestyle changes, and even certain cancers have higher survival rates when detected early. A gentle reminder, your weight isn't just a number on a scale, it's a reflection of your overall health. While weight loss might seem like a dream come true, unexplained changes should never be ignored. By listening to your body and seeking timely advice, you can uncover hidden issues and take steps to protect your well-being. After all, health is about living a balanced and fulfilling life, not just reaching a certain size. Frequent headaches. A painful clue to your health. Headaches are so common that they're often brushed off as minor inconveniences, just a side effect of a long day or not enough coffee. But when headaches become frequent, severe, or disruptive, they're no longer just a nuisance. They're a signal that something deeper could be at play, and paying attention to them could save you from bigger health problems down the road. What causes frequent headaches? Not all headaches are created equal, and their causes can vary widely. Understanding what's behind your pain is the first step to addressing it. Here are some potential culprits. 1. Migraines. These aren't just bad headaches, they're a neurological condition that can bring debilitating pain, sensitivity to light and sound, and even nausea. Migraines often have triggers such as hormonal changes, certain foods, or stress. 2. High blood pressure. Often called the silent killer, hypertension doesn't always present clear symptoms. However, severe or recurring headaches, especially at the base of the skull, could signal dangerously high blood pressure levels. 3. Neurological disorders. Conditions like brain tumors or aneurysms are rare but serious causes of chronic headaches. While these are less common, they underscore the importance of taking persistent headaches seriously. 4. Chronic stress or sleep deprivation. Lifestyle factors like unrelenting stress, poor posture, or lack of sleep can lead to tension headaches that feel like a tight band squeezing your head. Real-life example. Sarah's journey. Sarah, a 29-year-old marketing manager, started experiencing headaches that grew more frequent over several months. At first, she chalked it up to her demanding job and daily coffee habit. But when the pain began waking her up at night, she realized it wasn't normal. She started keeping a headache diary, noting when the headaches occurred, how long they lasted, and what she ate or did beforehand. This simple habit helped her doctor identify a pattern. Her headaches were triggered by certain foods and exacerbated by her irregular sleep schedule. The diagnosis? Migraines. With the right combination of dietary adjustments, stress management, and prescribed medication, Sarah regained control over her life. Why a headache diary matters. Tracking your headaches can provide critical clues to uncovering the root cause. Include details such as frequency. How often do the headaches occur? Intensity and location. Is it mild or severe? Where does the pain feel strongest? Triggers. Did you skip a meal, drink alcohol, or face a stressful situation? Associated symptoms. Do you experience nausea, vision changes, or dizziness? This information gives your doctor a clearer picture, making it easier to pinpoint causes and tailor a treatment plan. When to seek help. Not every headache warrants a doctor's visit, but there are warning signs you shouldn't ignore. Sudden, severe pain. A headache that comes on like a thunderclap could indicate a serious issue, like an aneurysm. Headaches with neurological symptoms. Difficulty speaking, vision changes, or weakness could point to a stroke or other neurological problem. Recurring pain that disrupts your life. If headaches are affecting your work, sleep, or daily activities, it's time to see a specialist. A wake-up call. Frequent headaches are your body's way of telling you that something might be off, whether it's your blood pressure, your stress levels, or an undiagnosed condition. Ignoring them won't make them go away, it could make things worse. Final thoughts. Your health deserves attention, and so do your headaches. They're not just a symptom to mask with over-the-counter medication, they're a puzzle to solve. By listening to your body, tracking your symptoms, and consulting a doctor when necessary, you can uncover the root cause and take meaningful steps toward relief. After all, life is too short to spend it in pain, especially when answers are within reach. Changes in skin appearance, your body's health on display. Your skin isn't just a protective barrier, it's also a mirror reflecting your internal health. From subtle changes like discoloration to more noticeable issues like persistent rashes or non-healing wounds, your skin often gives clues about what's happening beneath the surface. Ignoring these signs could mean missing the early warning signals of serious health conditions, what your skin could be telling you. Changes in your skin's appearance aren't just cosmetic concerns, they're potential indicators of underlying health issues. Here's what some common skin changes might signify. 1. New moles or changes in existing moles. Skin cancer, including melanoma, often begins with alterations in moles. The ABCDE rule is a handy guide. AC, symmetry. One half of the mole doesn't match the other. B. Orders. Edges are irregular or blurred. Color. Multiple colors appear in one mole. Diameter, larger than a pencil eraser. Evolving. The mole changes over time. Early detection of melanoma can be life-saving as it's highly treatable when caught early. 2. Non-healing wounds. A wound that doesn't heal after several weeks could indicate skin cancer or diabetes, which impairs circulation and slows healing. Discoloration or persistent rashes. Patches of red, purple, or yellow skin might be linked to conditions ranging from eczema to autoimmune diseases like lupus. 4. Persistent itching or dryness. While often linked to simple issues like dry weather or detergents, these symptoms could also point to kidney disease or liver problems, as toxin buildup in the body can affect the skin. Real-life example. Lisa's warning sign. Lisa, a 45-year-old yoga instructor, noticed a small, scaly patch on her arm that wouldn't heal. At first, she thought it was just dry skin from being in the sun too often. But when it started bleeding slightly after weeks of no improvement, she decided to see a dermatologist. The diagnosis? Basal cell carcinoma, a common but highly treatable form of skin cancer. The lesion was removed, and Lisa was encouraged to wear sunscreen and monitor her skin closely. Her quick action prevented the cancer from spreading and underscored the importance of paying attention to even minor skin changes. How to monitor your skin. Becoming your own skin detective is easier than you think. Here's how. Perform monthly skin checks. Stand in front of a mirror and examine your entire body, including hard-to-see areas like your scalp, back, and the soles of your feet. Note any changes. Keep track of new spots, changes in existing moles, or persistent issues like rashes or dryness. Take pictures if needed to monitor progress. Be proactive. Use sunscreen daily, avoid tanning beds, and moisturize regularly to maintain healthy skin. When to seek medical advice. Not every skin change requires a trip to the doctor, but certain signs shouldn't be ignored. Non-healing sores or lesions, new or changing moles, severe itching or rashes that don't improve, sudden discoloration or swelling. A dermatologist can evaluate these symptoms and, if needed, perform a biopsy, or recommend further testing. Why early detection matters. Your skin is one of the most visible indicators of your health, and changes in its appearance can signal serious underlying conditions. Early detection of issues like skin cancer, autoimmune disorders, or even diabetes can lead to more effective treatments and better outcomes. Final thoughts. Think of your skin as a storyteller. It reveals much more than meets the eye. By paying close attention to its changes, you can catch potential health issues before they escalate. Remember, protecting your skin isn't just about looking good, it's about staying healthy and thriving. Don't ignore what your skin is trying to tell you. Listen, act, and prioritize your health. Digestive issues. When your gut is trying to tell you something. We've all experienced a little bloating after a big meal, or the occasional bout of indigestion after indulging in rich food. But when digestive discomfort becomes a persistent companion, it's time to listen to what your body is trying to say. Your digestive system is intricately connected to your overall health, and ongoing issues could point to underlying conditions that require attention. Common digestive red flags. Digestive problems aren't just inconvenient, they can be signs of more serious health concerns. Here are some common symptoms and what they might indicate. 1. Frequent heartburn or acid reflux. Occasional heartburn after spicy food is one thing, but persistent acid reflux could be a sign of gastroesophageal reflux disease, GERD. If untreated, GERD can lead to complications like esophageal damage or even Barrett's esophagus, a precursor to esophageal cancer. 2. Chronic constipation or diarrhea. Ongoing issues with bowel movements could point to conditions like irritable bowel syndrome, IBS, celiac disease, or inflammatory bowel disease, IBD, such as Crohn's disease or ulcerative colitis. 3. Bloating and discomfort. While occasional bloating is often harmless, persistent bloating could be linked to food intolerances such as lactose or gluten, or even more serious conditions like ovarian cancer or intestinal obstructions. 4. Blood and stool or persistent pain. These are urgent red flags that could indicate gastrointestinal cancers, ulcers, or hemorrhoids. They should never be ignored. Real-life example. Tom's gut instinct. Tom, a 38-year-old software engineer, began noticing frequent heartburn after meals. At first, he attributed it to stress from his demanding job and started popping antacids regularly. However, when the discomfort turned into a burning sensation that kept him awake at night, he knew it was more than just work stress. A visit to his doctor and an endoscopy revealed that Tom had GERD and a small esophageal ulcer. With dietary changes, medication, and stress management, Tom was able to manage his condition and prevent further complications. His experience underscores the importance of addressing persistent digestive issues early. How to monitor your digestive health. To better understand your gut's behavior, consider these steps. Keep a food diary. Track what you eat and note when symptoms occur. This can help identify triggers like specific foods, stress, or eating patterns. Pay attention to frequency and duration. Occasional discomfort is normal, but issues persisting for weeks or months should prompt a medical evaluation. Be honest about symptoms. Discuss even embarrassing details with your doctor. Full transparency helps pinpoint the problem. When to seek medical help. Certain symptoms demand immediate attention, including blood in stool or black, tarry stools, unexplained weight loss, severe or persistent abdominal pain, chronic changes in bowel habits. These could signal serious conditions from infections to cancers, and early detection is key to effective treatment. The importance of gut health. Your gut doesn't just digest food, it's central to your well-being. It hosts trillions of microbes that influence everything from immunity to mental health. Chronic digestive issues can disrupt this balance, leading to a cascade of problems throughout your body. A healthier path forward. Listening to your gut means more than avoiding certain foods. It's about tuning in to your body's signals and acting on them. Whether it's heartburn, bloating, or changes in bowel habits, don't dismiss these symptoms as trivial. Seek advice, make lifestyle adjustments, and prioritize your digestive health. It's a cornerstone of your overall wellness. Life's too short to live with discomfort, and your gut deserves care and attention. By addressing digestive issues early, you can enjoy not just better health, but a more vibrant and fulfilling life. Chest discomfort, a symptom you should never ignore. Chest discomfort is one of those symptoms that can send a wave of anxiety through anyone, and for good reason. While not all chest pain points to a heart attack, it's a signal that something isn't right. Whether it's related to your heart, digestive system, or even stress, understanding the cause and acting promptly can make all the difference. What causes chest discomfort? Chest pain or discomfort can stem from a variety of conditions. Here's a breakdown of the most common culprits. 1. Heart-related issues. Heart attack. Severe chest pain that radiates to your arm, jaw, or back, often accompanied by shortness of breath, nausea, or sweating, is a classic sign of a heart attack. Women, however, may experience subtler symptoms like fatigue, lightheadedness, or mild chest discomfort. Angina. This type of chest pain occurs when the heart doesn't get enough oxygen-rich blood, often during physical exertion or stress. While not as life-threatening as a heart attack, angina signals underlying coronary artery disease. 2. Digestive causes. Heartburn, a burning sensation behind the breastbone caused by stomach acid refluxing into the esophagus, can mimic heart-related chest pain. However, heartburn doesn't usually come with shortness of breath or radiating pain. Gallbladder problems. Pain from gallstones or inflammation can sometimes feel like chest discomfort, especially after eating fatty foods. 3. Anxiety and panic attacks. Stress or anxiety can trigger chest tightness, rapid heartbeat, and a sense of impending doom, mimicking heart attack symptoms. These episodes are scary, but not life-threatening, though they should still be evaluated by a doctor. Number 4. Musculoskeletal strain. Chest pain caused by pulled muscles or inflammation in the ribcage area can worsen with movement or deep breaths, distinguishing it from heart-related pain. Real-life example, Mark's wake-up call. Mark, a 54-year-old accountant, dismissed his mild chest discomfort as heartburn after a heavy meal. But when the pain returned a week later during a walk and radiated to his left arm, he decided to visit the emergency room. Tests revealed he had a partial blockage in one of his coronary arteries, an early warning of a potential heart attack. Thanks to his quick decision to seek help, Mark underwent a successful procedure and avoided a life-threatening event. How to recognize when it's serious. Chest discomfort doesn't always come with flashing neon signs, but there are key symptoms that warrant immediate medical attention. Severe pain or pressure, especially if it feels like an elephant is sitting on your chest. Radiating pain to your arms, jaw, back, or neck. Shortness of breath, particularly if it's sudden or severe. Nausea, dizziness, or sweating, classic signs of a heart attack. Pain triggered by activity. Pain that subsides with rest could indicate angina. Why prompt action matters. Chest discomfort, especially from heart-related causes, is time-sensitive. In the case of a heart attack, every minute counts. Quick action can minimize heart damage and save lives. Even if it's just heartburn or stress, understanding what's causing your chest pain can provide peace of mind and guide you toward the right treatment. How to protect your heart and health. Here are practical steps to reduce the risk of chest discomfort. 1. Know your numbers. Regularly monitor your blood pressure, cholesterol, and blood sugar levels. These are key indicators of heart health. 2. Adopt heart-healthy habits. Exercise regularly, eat a balanced diet, and avoid smoking to keep your heart in good shape. 3. Manage stress. Practice relaxation techniques like meditation, yoga, or deep breathing to prevent anxiety-induced chest discomfort. 4. Stay proactive. Schedule routine checkups and discuss any concerns with your doctor. Final thoughts. Your chest is home to some of the most vital organs in your body, and discomfort in this area should never be ignored. Whether it's heartburn, anxiety, or something more serious like a heart attack, paying attention to your symptoms and seeking help can save your life. Remember, it's always better to be safe than sorry. If you're ever about chest discomfort, don't hesitate. Don't hesitate. Call for help. Your heart is too important to take chances with, and so is your life. Persistent cough or hoarseness. When a lingering symptom speaks volumes. A persistent cough or ongoing hoarseness might seem like a leftover nuisance from a cold or allergy season. But when these symptoms stick around for more than 3 weeks, they could be telling you something far more important about your health. Your respiratory system, vocal cords, and even digestive health might be trying to grab your attention. Why does a cough or hoarseness persist? While most coughs resolve within a few days or weeks, persistent symptoms could signal an underlying issue. Here are some common and not so common causes. 1. Respiratory infections. Post-viral cough. Even after a cold or flu, a lingering cough may persist due to inflammation in the airways. Chronic bronchitis. Often associated with smoking or exposure to pollutants, this condition causes prolonged coughing that produces mucus. Tuberculosis. Though rare in modern America, it's still a possibility, particularly in at-risk populations. 2. Acid reflux, GERD. Acid reflux doesn't just cause heartburn, it can irritate the throat and vocal cords, leading to a chronic dry cough or hoarseness. If symptoms worsen at night or after eating, GERD might be the culprit. 3. Allergies and asthma. Environmental allergens like pollen or pet dander can cause chronic coughing. Asthma, which inflames the airways, often manifests as a persistent cough, especially after exercise or exposure to cold air. 4. Lung issues. Chronic obstructive pulmonary disease, COPD. Common among smokers, COPD leads to chronic coughing and difficulty breathing. Lung cancer. Though less common, a persistent cough, especially if accompanied by blood, is a potential warning sign of lung cancer. Real-life example. Sarah's silent alarm. Sarah, a 42-year-old teacher, noticed her voice had been hoarse for weeks. She chalked it up to speaking loudly in her classroom. However, when her cough became more frequent, she visited her doctor. After several tests, she was diagnosed with early-stage lung cancer, despite being a non-smoker. Thanks to early intervention, her treatment was successful. This underscores the importance of listening to your body and seeking medical advice when something feels off. Red flags to watch for. Not every cough or hoarse voice is cause for alarm, but certain signs should prompt immediate attention. Coughing up blood or rust-colored mucus, unexplained weight loss, shortness of breath or chest pain, hoarseness that worsens over time. What can you do? If a cough or hoarseness lasts more than 3 weeks, consider these steps. 1. Track your symptoms. Note when the symptoms occur. Are they worse at night? Do certain activities or foods make them worse? 2. Avoid irritants. Stay away from smoke, strong fragrances, or allergens that might be exacerbating the issue. 3. Consult a doctor. Don't hesitate to seek medical advice. A thorough examination, chest x-ray, or even a CT scan can help pinpoint the cause. 4. Lifestyle adjustments. If acid reflux is to blame, elevating your head during sleep and avoiding trigger foods like caffeine or spicy dishes can help. The importance of early detection. The longer a symptom like persistent coughing or hoarseness goes unchecked, the greater the risk of complications. For example, respiratory infections can progress to pneumonia. GERD can cause damage to the esophagus if untreated. Early-stage lung cancer is far more treatable than advanced cases. Final thoughts. Your body is a remarkable communicator, and a persistent cough or hoarseness is one of its ways of saying, pay attention. While these symptoms are often benign, ignoring them could mean missing an opportunity for early diagnosis and intervention. When in doubt, don't wait. Whether it's swapping irritants, addressing acid reflux, or consulting a healthcare provider, taking action could save your voice, your lungs, or even your life. Numbness or tingling, a subtle sign you shouldn't ignore. We've all experienced a pins and needles sensation after sitting in one position for too long, and it's usually harmless. But what happens when numbness or tingling becomes persistent, occurs without clear reason, or appears in unusual patterns? These sensations may be your body's way of signaling something more serious. From nerve damage to life-threatening conditions like stroke, understanding these symptoms and acting quickly could make all the difference. What causes persistent numbness or tingling? While occasional tingling is often benign, persistent or unexplained numbness warrants attention. Here are some potential causes. 1. Nerve compression or damage. Carpal tunnel syndrome. Repetitive movements like typing or using a mouse can compress the median nerve in your wrist, causing numbness or tingling in the hands and fingers. Sciatica. Compression of the sciatic nerve, often due to a herniated disc, can cause tingling that radiates from your lower back down your leg. 2. Chronic conditions. Diabetes. High blood sugar levels can damage nerves over time, leading to diabetic neuropathy characterized by tingling or numbness in the hands and feet. Multiple sclerosis, MS. MS disrupts communication between your brain and body, often manifesting as unexplained numbness or tingling in various areas. Number 3, circulatory issues, peripheral artery disease, PAD-D, reduced blood flow to the extremities, often due to plaque buildup in the arteries, can cause numbness, especially during physical activity. Stroke, sudden numbness, particularly on one side of the body, may be an early sign of a stroke and requires immediate medical attention. 4, vitamin deficiencies. A lack of B vitamins, especially B12, can affect nerve function, leading to tingling sensations. Real-life example, Jim's close call. Jim, a 57-year-old avid golfer, began noticing a tingling sensation in his left arm that would come and go. Initially, he shrugged it off, thinking it was related to his grip on the golf club. One morning, he woke up unable to feel his hand and noticed slurred speech. His wife recognized the signs of a stroke and called 911. Thanks to her quick action, Jim received treatment within the critical window and made a full recovery. This story highlights the importance of recognizing when numbness or tingling may signal a medical emergency. Red flags that require immediate attention. While numbness and tingling aren't always alarming, certain situations demand urgent care. Sudden onset, especially if one-sided. This could indicate a stroke, accompanied by weakness or paralysis, suggests serious nerve or brain involvement. Linked to trauma, could point to a spinal injury, accompanied by confusion, slurred speech, or vision changes. Classic signs of a stroke. What should you do? If you experience persistent or unusual numbness or tingling, here's how to respond. 1. Track your symptoms. Note when the symptoms occur, how long they last, and whether they're triggered by specific activities or positions. 2. Evaluate your lifestyle. Repetitive strain, poor posture, or prolonged inactivity can exacerbate nerve-related symptoms. Adjust your habits accordingly. 3. Seek medical attention. Persistent numbness or tingling should always be evaluated by a doctor. Tests like blood work, MRIs, or nerve conduction studies can help pinpoint the cause. 4. Act immediately for sudden symptoms. If symptoms come on suddenly, especially with other stroke-like signs, call 911. Time is critical in minimizing damage. Prevention and care. Addressing the root cause of numbness or tingling often requires lifestyle changes or medical intervention. Here are some proactive steps. Maintain a healthy diet. Ensure adequate intake of vitamins, particularly B12, to support nerve health. Stay active. Regular exercise improves circulation and reduces the risk of nerve compression. Ergonomic adjustments. If your work involves repetitive tasks, invest in ergonomic tools and take frequent breaks. Manage chronic conditions. Keep conditions like diabetes or high blood pressure under control to prevent complications. Final thoughts. Numbness or tingling might seem minor, but it's often a clue to deeper health issues. Whether it's a warning sign of diabetes, nerve damage, or a stroke, paying attention to these sensations can save you from long-term consequences, or even save your life. When it comes to your health, there's no harm in being cautious. Persistent or unexplained numbness is your body's way of asking for help, so don't ignore it. Listen to what it's telling you and act swiftly. Your body speaks to you for a reason. By paying attention to these early warning signs and reaching out for help when needed, you can take control of your health and stop minor issues from turning into major problems. Which of these signs will you watch out for more closely? Share your thoughts in the comments. And don't forget to like, share, and subscribe for more valuable health tips from Healthies. Together, let's create a healthier future.